and we're going to welcome on stage a couple of folks who are joining us here in the nave. So please welcome Ignacio Díaz de Tuesta, who is a cardiovascular surgeon, MD and PhD. Thank you so much for joining us, Ignacio. And joining him is Chema Castillo, who is the technical director. Hello. At IBM Cloud and Cognitive Software. And we were supposed to be joined by another guest, but we're just having a few issues there. So we're going to, hopefully they'll be joining us in a few seconds, but we're going to crack on with your good selves. Thank you so much for joining us here. So we're going to kind of talk about, the future of health, the healthcare sector, etc. So Ignacio, I wonder, could we look back at what's just happened, and could you maybe describe the sanitary collapse that happened in Spain during March 2020?
Well, as you know, we have here a close to collapse, either a collapse of the sanitary system. And as you know, many patients arrive to ICUs with a strong respiratory failure.
Yes.
They request breathing machines, and breathing machines in this moment were in a shortage around Europe. So we face a very severe problem of choosing which patient go to ICU, which doesn't go.
Yes.
And instead of wait in a coach looking at the TV, we decide to act. So we join a group of scientists, engineers, managers too, and we start building a new concept of breathing machine.
Amazing. And how did this kind of affect? There was a shortage of ventilator stock. So how did this feed into that situation?
Well, what is important is why we arrived to this situation. This is due that the technology for breathing machines is produced only in a small amount of countries around the world, basically China, Germany, and USA. The rest of the countries, we buy them. And the increase of cases around the world produce a difference between what we want and what we have. So we have to create the breathing machine.
Absolutely. And who was involved in this cooperation to bring this new machine?
Well, we were involved with many people. This is a success of a society, not only of our team. We are a reduced team of 10 persons, but we have the help of people like the actor Antonio Banderas, who support economically the product, singer Pablo Alborán, and even enterprises like Zurich Insurance and Endesa. And we have too the logistic head of many people like Jose Minguez and many other people who participate in what they could to achieve our goals.
Yes, and what is the goal? What's the eventual goal that you would like to see from the whole process in this brilliant collection of amazing people?
The goal was to have a cheap and reproducible machine that could be assembled in any country around the world at a specific rate of one every 30 minutes. We have built 300 of these machines. We still keep producing more, and we are exporting them to countries in America.
Amazing. Where can people find out more about this? Is there information online?
Oh yeah, of course. This is a non-profit work. Our license is free. Anybody who needs the breathing machine can ask we for produce them, or they can produce by themselves in any country. So anybody, as far as they don't take profit for themselves, but for the people, can reproduce our work.
Amazing. Well, thank you. That's such an impressive initiative, and I think it's going to save many lives. So moving over to you, Chema, talk to us a bit about the main challenges for medical prevention and diagnosis from a technology point of view.
Well, I think from a technology point of view, the most important thing probably is the challenge we face around data, no? And all the processes.
Yeah.
I think, when we think about the patient, we think about the many data that are around not only the genomic data, or not only the clinical data, but also the kind of ecosystem around this kind of data. So ecosystem around the patient, insurance company, pharma companies, this genomic data, clinical data is sometimes it's complex, no, to solve. And this is one of the things, IBM with the technology and with the cloud computing is trying to solve and to accelerate, no? To be the enabler for these kind of challenges.
Absolutely. And speaking of which, what do you think the role is of technology and IBM specifically in the healthcare industry moving forward?
Well, IBM has a long story about research, and for example, we have 12 labs around the world. We are focusing on data, AI, quantum computing. and it's very focused on solving these complex problems. No? For example, last week we announced that in 2023 we had 1,000 qubits. That is the measure, how to measure these non-polynomics problems that we will face in all industries, but mainly in the healthcare, for example. No?
Fantastic. And what kind of initiatives is IBM working on around the global pandemic, the COVID-19 issue?
Well, we have several initiatives, but for example, we have Watson for Citizens. In this pandemic, information is crucial, and we offer without any cost for 90 days these kind of initiatives in order to inform all the citizens, the new protocols, all the new laws. So that was a very important initiative, and we have also examples in Spain that it was very important for us because in the north of Spain, in the Basque Country, we have Vizcaya that they needed to have information, and we were able to put in live an application in 2 weeks with a cloud platform, with our IBM public cloud platform. It was a challenge. It was very personal, very emotional. Probably the most emotional project I've been involved in my 17 years of career. So.
Yeah, amazing, amazing. Well, thank you both of you for everything you're doing. And we're actually going to be joined by a third guest now, who, using the magic of technology, joins us here on this amazing screen. Welcome, Rocio Arroyo, who is the founder of Amadix. Thank you so much for joining us. So,
thank you for having me. Hello, everybody.
Hola. So, Rocio, talk to us a bit about how you see the future of health and the healthcare sector perhaps reinventing itself.
Yeah, the sector is definitely in the middle of reinventing itself. We see telehealth allowing interaction between doctors and patients through a webcam, avoiding, luckily, the patient going to the hospital and decreasing the risk of COVID-19 and other infections. I think today patients are taking on a very active role in the management of their health, of our health, thanks to mobile applications like virtual nursing assistants to reduce emergency room visits, to a new mobile app. And now a virtual nurse can check your symptoms and book medical appointments for you, no need to type. So I think the sector as of today is facing every day more services available digitally. We saw how the UK National Health Service partnered with Amazon to allow elderly people to access to health information, asking Alexa questions like, what are the symptoms for COVID-19, or how do I treat a migraine? So this is a different animal, the healthcare sector today, and doctors are even able to work from home while performing long-distance surgery in a different country thanks to 5G technology.
Indeed, indeed. And just quickly, how do you think the COVID-19 pandemic has affected medical prevention and diagnosis, and what do you think the future holds?
I think it is seriously affected the diagnosis and the prevention, because the risk of infection by COVID-19 has increased and diagnostic procedures have been delayed, and COVID is causing a significant backlog of screening colonoscopies, with millions of colonoscopies missed during these months of pandemic. So there's a clear need for alternative cancer testing options, because we will face additional thousands of deaths from colorectal, breast cancer, and other diseases during the pandemic.
Yeah, absolutely. Okay, and I'm afraid that's all we have time for, but thank you so much for joining us. Rocio, Ignacio, and Chema, thank you so much. That was absolutely fascinating, and thank you for the great work that you're all doing. It was very emotional hearing about that, and we are all very grateful. So wonderful.